Okay, hello, it's Dr. Buford. We're just getting started on your right shoulder. We're looking in from the back to the front. Everything's magnified 30 or 40 times on the screen. And right now, yeah, give me a little more slack here. Right now, we're just going to put in a shaver here because I want to show you a couple things. Hold the camera here, please. So some of that frayed tissue, you see, that's actually coming off the biceps anchor. Looks like we're zoomed in. Let me see if we can zoom us out here. I'm going to go off on the video just for a second. Okay, so here's the biceps tendon. To the left of that, we're going to see the rotator cuff tear. There's the big hole in the tendon in the rotator cuff. And this is torn biceps anchor. This is what we would call a slap lesion, or in your case, a degenerative slap lesion from the wear and tear changes here. And once we get this smoothed out a little bit, I'm going to show you how we do this tenodesis. Hold the camera here. We're going to put the cannula back in, and I'm going to take a spinal needle in just a second here and pass that through the rotator cuff. Okay, so there you see how we take the spinal needle right through the rotator cuff there. We're going to pass a black wire. Hold the camera real still right there. We're going to pass a black wire called a super shuttle grasper. And we're going to grab that wire. This wire has holes in it. Okay, hold that. Okay, so we're going to bring this shuttle relay here. We're going to load it with a suture. And that's going to take us, stay right on the screen with me. That's going to take us through the tendon just like that. We're going to do the same thing one more time with our spinal needle. That looks like a pretty good spot. That'll give us a good hold on the tendon there. So this time we're going to go ahead and feed the relay through a whole bunch. And I'll show you why we have to do that in a second here. Okay, here you go. Okay, so now we've got the biceps secured. We've got that loop going around it here. You can see that. We have a pretty good hold on that biceps. We're going to go ahead and take a pair of scissors and cut it right at the base, way down low. Okay, and so now we have the biceps released. Let me see the orange for the cannula. I'm going to put the shaver back in and just smooth out what's left of that labrum and that part of the shoulder. But the good thing is that now that the biceps is released, this labrum shouldn't sustain any more traction injury or any more damage from the biceps pulling on it or torquing on it. Okay, so I want to show you the rest of the shoulder before we leave inside the joint. This is the posterior capsule. There's the posterior glenoid. I don't really see much in the way of arthritis, so that's good. There's a subscap tendon in the middle glenohumeral ligament. Inferior glenohumeral ligament be down here. And that's all checking out pretty good there. So hold the shaver again. We're going to rotate back up, and from this vantage point, you'll see just behind the biceps, here's this big tear in the rotator cuff tendon. And this is where we're going to be spending most of the rest of our time here, just trying to reattach this rotator cuff right down here. So I think we've got a pretty good idea of what our job is looking like here to fix this rotator cuff. Okay, so here we are in the subacromial space. We're above the joint. This is the acromion bone at the top of the screen. Let me show you the rotator cuff tear. That's right here. That's the hole in the rotator cuff tendon. We're going to deal with that in a minute. But what I wanted to show you is one of the things that probably contributed to this big tear, which as we come from the left side of the screen, which is the back of your shoulder, towards the front, look what happens. This is level, level, level. But then here, we start going down because you've got this big hook on the anterior acromion. See this thing? The difference between here and your shoulder is about 8 millimeters. Okay, maybe even a little bit more, maybe even a full centimeter. So this thing is what can act like a little axe and cut into the rotator cuff. So we're going to remove this because it's not helping anybody anymore, and it probably contributed to the cuff tear. So the last thing we'd want to do would be to repair the cuff and leave this this big spur. So turn off the outflow on the front here. Just turn that. Yeah. No, the other one. Yeah. So in just a few minutes, really, not even a few minutes, a few seconds, you can see how we have a freshly cut edge, and that spur is gone. And the good news is it doesn't grow back. And so now I'll show you in a second how nice and level. Okay, so now you can see we start in the back, and remember before we had to come way down here. Well, now it's gone. Still probably a little bit more I can do, but I'm happy now. That allows the cuff a chance to breathe without that bone pushing on it all the time when you raise your arm up. We'll make sure we get over here lateral. Sometimes there can be a little bit of a lateral slope too. But I think you get the general idea. So that spur is now gone. And just that little bit of surgery makes all the difference in the success of the repair, in my opinion. Because now we don't have anything left that can dig into that cuff. So now we have all this extra room here. Okay, so here's the hole in the tendon. Right here. To the left is posterior, so we can see there's, like these often are, there's a delaminated deep layer. See how this is split? That's all I'm trying to say there. There's a couple different layers to it. We have to get all those layers incorporated in the repair to maximize our chance at getting this all to heal well for you. And then here's anterior to the right. Your biceps tendon, if we kept looking, would be right there. See, that's the long head of the biceps right there. See how that runs? And so we're going to be placing a suture anchor down, for starters, right about here. I just want to make sure we can get our posterior repair. Yeah, we can get a suture anchor down right about here. Here's the articular margin. The edge of the footprint laterally is here. And so we're going to place our anchor probably just to the articular side of the midline. So if this is midline, this line right here is basically midline. We're going to place our anchor just right about here. Hold the camera here. Okay, so here's all three sutures coming from the first anchor in the bone. That looks good. We're going to go ahead and reach in with our crochet hook. We're going to use a straight and then a turn to the right after that. So with our crochet hook, we're going to look at these. Yeah, I guess I can take the blue one first. So we'll take that. Hold all the sutures. Pull tight. Yeah. And then let go of them all now. Okay, so we have one suture out here. We're going to take our straight suture hook and a grasper to Garth in the front. Sorry. Here's our hook. It's loaded with that same black wire we used for the biceps tenodesis. But what we're going to try and do is come through right about here. Hold the camera there. Okay, so what we've done here is we've already passed, but not yet tied, the other two sutures from the first anchor. You can kind of see them going off here outside. They're going off here outside the cannula. And we've still got this gap here, and we've still got your biceps tendon that we're going to incorporate into this repair. And there's the edge of the biceps. So we've already pulled out the bicep sutures in preparation for using them in a little bit. But the next step for us is to look at this tear and to place an anchor right about here. So we'll go ahead and go off on the video, show you some more in a minute. Okay, so here's the next anchor in. We've got 3 more sutures to work with. One of those we're going to use with the biceps also. So we'll show you some more in just a minute. Okay, crochet hook. Okay, so we've got all the sutures passed that we want. It looks like a suture spaghetti, doesn't it? But a lot going on here. We've still got 2 sutures from the first anchor. From the second anchor, we've got all 3 sutures past the third one. See how those black and white sutures go through the biceps? So we're going to have the biceps secured as well as part of this. This is all going to come together nicely, I think. The next step for us is to start tying these one at a time from back to front. So here's the blue and white suture that's the next in line from the back. Remember, the back is on the left side of the screen. And as we look down here and decide which way to take it, I think that's it right there. And so that's going to be our next loop right there. We'll tie that and show you some more in a minute. Okay, so there's the biceps tenodesis. You can see that's stuck down as you rotate your shoulder. That's all moving together as a unit. There's our rotator cuff behind it. We're going to take a little punch. Do you have a little 2mm punch? Make some little holes in the tuberosity to promote some healing also. This is kind of our easy way to access the bone marrow space. But right now I'm very happy with the way that looks. That looks very solid. Okay, so here's our punch. And we don't obviously want to disrupt the repair we've made, so we'll just make some little holes. Let you go, wait 1 second, let's see. We'll go down a little bit lower. Okay, so tap me there. Keep going all the way down to the break. Keep going. Okay, good. So there's one. We're going to make several of those. And that's going to allow the bone marrow and some of the other things in the bone marrow to come out. Hold the camera here. Sorry. Got it? There's another one down here. Go ahead. Ready? Okay, there's 2. That one's anterior, obviously. That may be all we have to do. So we're going to finish up here and get you back to the recovery room shortly. Good luck to you now. Bye-bye.